Traction devices have been around for many, many years, used for a variety of medical conditions. For the penis, there are devices which look like a little mini rack, which pull on the penis in the flaccid condition. And by pulling on the penis, you can activate certain types of cellular processes, which makes the cells actually grow. And specifically for the Peyronie's patient, we can get potentially more length. We can have reduction of curvature. We can see indentations correct themselves and require better girth, and also ultimately get remodeling of the scar. Traction devices must be used properly. To get the best results with traction devices, they need to be worn for many hours per day. We have found from recent research that if you wear the device for 3 or more hours per day on average, so some days may be 2, but other days may be 5, but if you do at least 3, we can pretty reliably see improvement of girth, length, and curvature correction. It takes a long time. Nothing happens fast with any scar tissue. I like to say that scar tissue moves at glacial speed. And so applying this traction device needs to be for a prolonged period of time. And in fact, the longer you wear the device per day, on average, over a period of time, the better the result you're going to get. There is, without a doubt, evidence now to show that penile stretching devices may be the most important of the treatment options that we now have available as non-surgical treatment for Peyronie's disease. And the reason for that is because with the application of these forces on the tissue, we have now shown scientifically that there are changes that occur that will help remodel the scar and potentially help with growth of tissue within the area of the scar that can help correct that deformity. I have treated now over 900 men with Peyronie's, and I would say that the men who commit to the protocol, which means 3 hours or more on average per day, that we pretty reliably can see the better part of an inch of length gain and probably 20 or more degrees of curvature correction. In fact, the men who I've seen over the course of the past 6-7 years where I've been using this device, the best curvature reduction we had was in a man with a calcified plaque, a 70-degree downward ventral curvature, who after 6 months of using the device was straight. Pretty impressive. I do believe that a traction device provides benefit over a vacuum device. And the reason for that is because you can only use the vacuum device for a short period of time. Typically, it's a 10-minute treatment session, which you can do multiple times per day, but most people will do 1 or 2 sessions per day. So that's 20, maybe 30 minutes of exposure time to the stretching forces. Whereas with traction therapy, we can wear it for 2 hours at a time and potentially multiple sessions of 2 hours. I like to think of using traction in terms of duration as we have braces on our teeth. If you had to put braces on, you wear them 24/7, and for 2 years, as the orthodontist tightens up your teeth, we will see slow, gradual correction of that curvature. But if the kid who needs the braces says, no, I'm not going to wear them to school, I'm only going to wear them on the weekends, Saturday and Sunday, sure, their teeth will get straight, but it's going to take much more time to be able to accomplish that because the duration of time is very much correlates with the changes that we want to have to happen with the tissue. So just brief pulling on the tissues, a quick yank or a 10-minute pull, I don't think has the opportunity to activate the mechanical changes that we want to have occur within the tissue. The risk of traction would be if you were to wear it too long, there is a potential risk of tissue injury. For that reason, we restrict the wear time at 2 hours per session. So if you've got the time to wear it some evening, say after work, you can put it on for as much as 2 hours, but then you have to take a break to allow the tissue to rest, and then you can apply it again after 10 or 15 minutes. The concept here is that because of the device, the way it's set up to hold the head of the penis in place, there's a lot of compression forces that will reduce blood flow. And so for a short period of time, 2 hours, it's safe. And in fact, in my 900 or more men that I've been treating over the past 6 years with Peyronie's disease and traction, the worst thing that we've seen have been 3 men who have had a little abrasion just behind the head of the penis where the strap sits. And those abrasions simply heal after a couple days of rest. We've not seen any new erectile dysfunction. We've not seen any Peyronie's get worse. We've not seen any infections or change in penile sensation. So overall, a pretty safe approach when done properly.